expropriation debate to the medical sector, and fair to say that the country's healthcare system is at something of a crossroads. The government remains committed to the National Health Insurance Act, but many experts are arguing that it's unworkable in its current form. We've heard that before. Now, the Universal Healthcare Access Coalition has now put forward an alternative, a pragmatic, it says, evidence-based reform plan that aims to improve both public and private healthcare without overburdening taxpayers. Joining us now is Professor Alex van den Heever, a key member of the steering committee of the coalition. Professor, welcome. You've called the NHI unworkable and unfixable. Just remind us what your key concerns are. What are the key flaws in the plan?
So there are sort of two key aspects. The one is that it proposes it is essentially only feasible if there's a massive tax increase that's introduced, and that is in order to be able to substitute the contributions made to medical schemes and draw them into the public health system. In other words, draw them in as public revenue. That is not feasible. We're at tax capacity. That can't be done. The second aspect is it proposes to basically unravel two major parts of the health system in order to create a third version we've never had. So this centralized purchasing structure that they propose, that both of those aspects make this proposal largely unworkable, and it involves a massive deviation from the current health system and is very unlikely to ever be implemented. So those are the reasons why the NHI process actually is just going to hold us back on actual reforms, because it'll never be implemented, but they will implement nothing while they wait to implement NHI. So
your argument then is the single tax funded model for NHI is financially unsustainable. So how does the coalition's mixed funding model work and improve on this?
So all countries basically have to have, certainly if you're not in the top sort of 5 or 6 industrialized countries, you have to have a mixed model. You have to combine tax financing with some kind of contributory system. But in order to make people contribute to the sort of contributory system where you pay for access to insurance, for instance, is that you have to, it can't be a tax. It has to be that you're paying for your own coverage. But you have to make that a workable and accessible system. The tax finance system needs to be governed properly. So our proposals basically say there are enormous flaws in both our systems. To mix them, you have to make sure that we have a well-governed free public service and we have a well-governed contributory system through medical schemes. We can't actually cover medical scheme members in the state. It's not going to happen. We have to have a contributory regime. The two together provide universal coverage in that people face either no or very limited point of service costs in accessing healthcare. So you're removing the access barriers at the point of service through being either covered through insurance or covered through the state. So that's the model. The overall framework focuses on correcting what's flawed in both of the existing systems and focusing on those issues, which government is basically just not bothering about.
You talk about improving governance in public healthcare, all well and good, but what specific changes would you recommend to depoliticize management and improve efficiency, given over so many decades there is a lot of entrenchment now?
Yeah, so there's a lot of vested interests who don't want any governance reform in the public health system because too many people have their fingers in the pie. And that's why nobody basically focuses on it and there's no political will. In essence, what you require is sort of two broad features that we discuss. One is that you decentralize the system. That is, you create more autonomy in the delivery side of services, coupled with supervisory structures that involve no political appointment. So you create a method by which you sever or let's say you create a sort of a distribution of functions between what the executive of government is responsible for and the administrations and the services are responsible for. So it proposes independent boards in which there are no political appointments, and they oversee hospitals with a lot of decision space and district authorities with a lot of decision space. By that I mean they've got autonomy, total control over their their organization, as opposed to the fragmented structure we have at the moment, where a person in charge of these facilities has to defer up a hierarchy, or has to defer to other organizations in the state to get anything done in a public facility. They have limited control, but they're also the wrong people in charge. So essentially, you need to change the governance model in the public system so that people who are capable of running hospitals are appointed, and they are replaceable by independent boards that supervise most of the major parts of the public health system. And we make suggestions on an appointments authority that would actually be independent of politicians, that would appoint the people into the supervisory boards. And this has nothing to do with the advisory boards that currently exist, that are largely completely useless. They involve political appointments, and they also have absolutely no power to do anything. They're largely just useless.
Staffing is the one issue. You also reference institutional corruption, which is a major issue in the public healthcare system. How would you address this problem?
So the institutional corruption arises, as you would see from the Zondo Commission and every assessment, is that the moment you have political appointments into a system, you can capture key parts of the system. You can capture the procurement processes. Appointments themselves are an enormous part of corruption. You appoint people, friends, cronies into the system. The appointment process also impacts on the quality of people who end up in leadership positions. So if you have a political network that's basically focusing on capturing a state organization, they basically appoint a network in, and they're on all sides of the decision-making process. So the way in which you eliminate that is basically creating these independent structures that are responsible for appointments and removal of people, and are responsible for overseeing the chief executive. That's absolutely critical. There's no way to stop corruption in our public system or any part of the state at the moment unless you create these fire breaks in the public system.
Thank you very much indeed, Professor Alex van den Heever, key member of the Universal Healthcare Access Coalition. I appreciate your time today.
Moneyweb at midday. For all your up-to-date